Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy. Today we are going to discuss a topic called as myolysis. Myolysis is a minimally invasive surgery for fibroid treatment. So today in this video we are going to discuss about what is myolysis, what are the types of myolysis, what is the procedure that you have to undergo if you are having myolysis done, and also what are the benefits of myolysis, what are the side effects of myolysis, or what are the risk factors of myolysis, and also what are the best treatment options for fibroid treatment. Let's dive into the topic. So what is myolysis? Myolysis is a minimally invasive surgery where it specifically treats the uterine fibroid tissue. Okay. So it treats the uterine fibroid tissue with certain kind of energy. It can be ultrasound, or it can be thermal, which is heat, or it can be cryo, which is cold. With any of these energies given, if they are treating the fibroid tissue so as to shrink it, then that is called as myolysis. What are the conditions needed for myolysis to be done? The first and foremost thing is age. If you're someone who is experiencing fibroids in their teenage, remember that myolysis should be done only after 18 years of age. Second thing, symptomatic fibroids. What do you mean by symptomatic fibroids? Some certain section of people, even though they have fibroids, they do not experience any sort of disturbing symptoms. But some people do experience symptoms. And what are these symptoms? It can be prolonged bleeding for more than 15 days in some people. It can continue up to 1 or 1.5 months in some people. Or even if they're bleeding for 5 to 6 days, the amount of the bleeding or amount of the menstruation blood that is coming out can be more. There can be clots that are passing. There can be pain in the hypogastric region, which is, pressing on to the back. There can be pain in the hypogastric region, which is, radiating downwards or extending downwards into the anterior part of their thighs. There can be pain in the lower hypogastric region where it is bearing down kind of pain, whereas someone is putting a hand in your hypogastric region and pulling the organs down. You have this bearing down kind of sensation. Or if you're having urinary tract symptoms like urgency in urine, or if you're having constipation symptoms, all of these symptoms come under fibroids. How is constipation and urinary tract symptom of fibroid? Because fibroids can cause pressure symptoms on the anterior part, which can lead into urinary tract symptoms, or on the posterior part, that is back part, leading into constipation. If you're having any of these conditions, you can get myolysis done. Apart from that, uterine volume. If the uterine volume is more, that is if they have bulky uterus, or if you are pregnant, 18th week, 19th week pregnant, or even if you have conceived itself, you should not be getting a myolysis done. Next, alternatives to myomectomy. If you're someone who is having multiple fibroids and you have to get it removed, then myomectomy might take a longer period of time compared to myolysis. So you can get myolysis done rather than myomectomy. Apart from that, multiple intramural fibroids, as we've already mentioned in the alternative to myomectomy topic, where if you're having too many fibroids, then it will take a lot of time for myomectomy to be done. So fibroid removal through myolysis can be much easier process. And then other medical indications. If you're someone who has to have a uterus, like for example, if you're planning for pregnancy, or if you do not want a uterus to be removed for hormonal imbalance, you want to keep it under control, and because of any other reasons that they cannot do a major hysterectomy or major operation on you, you can suggest myolysis for these kind of people. Now coming into the contraindications part for myolysis. What are the contraindications? Let's see. Viable pregnancy, even if it is RFA, which is radiofrequency ablation, it can be UAE, which is uterine artery embolization, it can be myomectomy, it can be myolysis, it can be anything. If you're pregnant right now, even though if you're having fibroids also, any of these treatments cannot be done. That is something that you have to remember. And then active pelvic inflammatory diseases. If you're having any sort of PIDs, UAE, RFA, myomectomy, myolysis cannot be done. And then malignancy of any kind, even the suspicion of malignancy or malignancy proven, they cannot do any sort of myolysis or any other factor surgeries like RFA, UAE or myomectomy. And postmenopausal bleeding of unknown cause or unknown etiology can also be a contraindication for myolysis. Why? Because postmenopausal bleeding usually occurs because if there is any sort of cervical cancer, that is the major cause for menopausal bleeding. And even though if you're having menopausal bleeding and you do not know the obvious causes for it, and then in these conditions also myolysis cannot be performed, as they will be taking this as a suspicion for cancer. Then fibroid location in cervix depends upon the location of the fibroid also. If the fibroid is in the cervix part of the uterus, then myolysis might not be a viable option for it. And then fibroids already infracted, which is observed in the MRI. Remember that they have to have a certain kind of test done before this myolysis, and in the MRI they are showing that the fibroids are infracted. What do you mean by infracted? It means that the fibroid tissue is dead, it is being putrefied, and it is dead as such. Okay, so if that is already dead, you need not get a myolysis done again. What are the tests to be done before conducting myolysis? First and foremost test, even if you are conducting a myolysis or UAE or RFA or myomectomy or hysterectomy or any sort of female operations as such, the first and foremost thing that you need to do is USG, which is ultrasonography of abdomen and pelvis, to know what are the problems associated with it. How are the fibroids? Where are they located? Is it always paired up? You know, sometimes people pair up or have diseases which are paired, like fibroids with bulky uterus, fibroids with endometriosis, fibroids with adenomyosis, fibroids with PCOD. We have seen cases in our clinic also which have paired up, or even triple diseases also. Sometimes you have fibroids, sometimes you have PCOS, fibroids and bulky uterus. Sometimes you have PCOS, fibroids and endometriosis. So we have seen cases like that and we have treated it. So if you are having any sort of those conditions, it is advisable to view it in the USG, and then to confirm those things we have to get an MRI. As you can see here in the picture, this is an MRI where, as you can see, this is the uterus, these are the pelvic bones, and this is the fibroid. So as you can see here, this is the bladder. As I told you, any fibroid can cause pressure on the bladder. Here it is causing pressure on the bladder, which is causing the bladder to become different. It is forming the bladder to become in a different shape. It is pressing down the bladder where you can have urge incontinence symptoms. So even MRI is also very important to know the dimensions in a proper manner. Apart from that, hysteroscopy, if you're someone who is suffering from submucosal fibroids, if you want to know what are submucosal fibroids, what are intramural fibroids or subserosal fibroids, or what are fibroids as such, and what are the causes of fibroids, and what are the investigations, general investigations to be done, and what are the treatment options, we've already done a video on it. We will be providing you with the link in the description box. You can go and check it out. And also not to remember, we have already done a video on the hormonal changes and also pregnancy causes for fibroids, or how is pregnancy affected due to fibroids. If you want to know about all of that stuff, we will be providing you with links in the description box. Please do check it out. If you're someone who's suffering with submucosal fibroids, then hysteroscopy is one of the procedure where a hysteroscope is inserted into the vaginal canal or into the vaginal orifice with a camera and a light in it to view the fibroids in a better manner. Apart from that, SIS, saline infused sonography, is also done to see the viability of the tubes and how far or how extent the fibroid is and how far you can remove it. So these are the primary tests. Apart from this, there are certain tests that you need to do when you're getting a surgery done. It can be any sort of surgery. So let's know the other kind of test. CBC. So what is CBC? CBC means complete blood count. So in complete blood count, we will be knowing if you are having any sort of infection, like if there is any sort of infection, you will be having a raise in neutrophils if it is acute, or raise in lymphocytes if it is chronic. How is your blood count? How is your HB? All of this we will be knowing about the quality of the blood, which is very important for surgical processes. So that is important. And apart from that, we have to do an ESR, which is called as erythrocyte sedimentation rate, which is important as it reflects the infection. If you have any sort of infection, you will be having a raised DR. If you have any sort of infection, we cannot get this myolysis done. So that's also very important. Apart from that, coagulation test is also very important, because if you're someone who is having coagulation issues or blood clotting issues, blood should clot after a surgery because you are putting a puncture, you're having a puncture done on your abdomen, right? If the blood isn't clotting well, if you're having coagulation issues, the blood will start to flow. There will be hemorrhage. It can be very hard on the heart, and it can need blood transfusion, or you will have to stay for a longer period of time in the hospital. So that is also very important to do coagulation test. Apart from this, to know if you're pregnant or not is very important before a surgery. So we have to do human chorionic gonadotropin test to see if you're pregnant or not. So these are some of the tests that have to be conducted before myolysis. Now let us get into the topic to know more about types of myolysis. The first one of type of myolysis is called as thermomyolysis. So what is thermomyolysis? As you can see here in the picture, this is uterus and these are the fibroids. The red circles are the fibroids, right? So what do they do in thermomyolysis is that they do a small puncture in the abdomen. A small puncture is made in the abdomen, and with the help of the puncture, some instruments are inserted. What are the instruments? It is a lab. Sometimes there can be a handpiece for whatever a procedure. If it is a thermomyolysis, then heat probe is inserted, and then camera can be inserted. So certain probes are inserted into the fibroid itself one by one, and then what happens is after insertion of these instruments, the camera, the handpiece, the probes and all, they will be inserting it into the fibroid, and after inserting they will be applying heat to this fibroid, and by applying heat to this fibroid, what will happen? There will be coagulation of the fibroid. So one after the other, heat is applied to all the fibroids, and the fibroids will start to coagulate and they will start to shrink. So this is called as thermomyolysis here. Here they are using heat to destroy the fibroid. That is very, very important in thermomyolysis. Next, coming into the cryomyolysis part. As you can see here in the picture, the uterus is with fibroids. The red circles are the fibroids, right? Same manner how they have done the thermomyolysis, we have been doing the cryomyolysis. Here they will be inserting or puncturing a small hole in the abdomen. Through the hole they will be sending a camera, a handpiece and whatever instruments are necessary, and they will start inserting it into the fibroid one after the other. Here they are freezing the tissue. By freezing the tissue, it will become like an ice globe, and through USG they will be seeing it, right? So whenever they are doing this cryomyolysis, this ice globe dimensions are clearly mentioned, or they can clearly see this ice globe in the USG, so they will know how far they have targeted, what are the dimensions of the ice globe, and else all of the other necessary things that they need to know. So cryomyolysis is application of cold or intense freezing of a certain tissue so as to make it dead or shrink. So this is called as cryomyolysis. This is also a second type of myolysis. Now the next kind of myolysis is called as ultrasound guided myolysis. Here it is not invasive kind of a treatment, or they're not going to do any punctures or any sort of holes in the abdomen. So what they're going to do is they're going to select the fibroid through the USG scan, and they're going to focus it with ultrasound waves. And high intensity ultrasound waves are going to destroy this fibroid. So this is ultrasound wave or ultrasound mediated myolysis. But the problem with this one is we do not know if it will destroy the fibroid completely. We do not know if the symptoms will subside, and we do not know if you are planning for pregnancy. We do not know what kind of this ultrasound can cause an effect on the baby, because it is of high intensity nature. So that is the third type of myolysis. And what are the other types of myolysis? You can use, apart from this energy sources, we can use laser techniques, we can use high radio frequency waves. All of this can also be targeted to the fibroid and destroy the fibroid itself. So these are some of the types of myolysis. Next, coming into the what are the benefits of myolysis? Why have we done this myolysis as such? Because we wanted to destroy the fibroid tissue. So that can be done, selective destruction can be done, and not apart from the fibroid, the other uterus is healthy, it is not being destroyed, so that is a good thing. Next one is shrinkage of the fibroids. This is very important because shrinking the fibroids will help in relieving the symptoms, right? And it will also help so that it will not grow, so that's also a main benefit. And apart from that, after the reduction of the symptoms, you can see that if you have reduced symptoms, you are healthy. So all of these are the benefits of myolysis. Now let us see what are the risk factors associated with myolysis. Remember, any treatment option, the benefits should outweigh the risks or the side effects of the treatment. If the risks outweigh the benefits, then that is not a proper choice of treatment. But here the risks outweigh the benefits, so it cannot be a proper choice of treatment. Why cannot it be, and what are the risks? Let us see. Infection. See, because we are doing a puncture or hole in the abdomen, it can become infected, right? So even if they are using doing it under sterile conditions, after the operation you will be admitted into the ward, right? So bacteria are everywhere, you can get infection. They will be giving you antibiotics, and antibiotics always need to be taken with proton pump inhibitors so that you will not have gastric symptoms. And also by taking a lot of antibiotics, your gut microbiome is disturbed and it is destroyed. Destroyed gut microbiome, what will it do? It will not help in absorbing the nutrients properly. So improper absorption of nutrients, your health can deteriorate. And also by using a lot of proton pump inhibitors and antibiotics, you can get acute gastritis as well. And also disrupted gut microbiome can cause stress, can cause physical stress on the body, which can lead into production of certain hormones, which can lead into hormonal disruption, further by enhancing or helping in it recurring the fibroid. Okay. And the second thing is adhesions. This is very, very important. If the infection is not controlled, if you're not in a healthy manner and the infection is not controlled, as you can see here in the picture, the body has a mechanism where it restricts the infection by putting adhesions or plasters on it. As you can see here, you can see the plasters, right? So if the infection is not properly taken care of, it can cause adhesions. Adhesions are very, very important and very risk factors, because adhesion can cause, improper movement. If the uterus is adhering to the colon, it can cause severe pain. It can cause pain even while defecating, because there is peristalsis. And also if the uterus is trying to contract, because of the adhesion is not able to contract, you will experience severe pain. You have to do another surgery to remove the adhesions also. And also if the adhesions are too much, then you have to remove certain parts of the body also. So this is also one of the risk factor for myolysis. Apart from that, failure to resolve symptoms. Remember that though myolysis is a very easy way of doing a fibroid removal, it cannot always sometimes decrease the symptoms of fibroids, because it cannot effectively shrink fibroid. Then the recurrence of the symptoms can also occur, and also the present symptoms can also not stop. So myolysis has this problem where there is failure in certain cases. Symptoms they're not resolving properly, and also the fibroids are reoccurring, they're enlarging even after that, or also the fibroid can become infected, and then it can start falling off after the shrinkage. It can fall off through the vaginal opening, which can cause severe pain, infection, septicemia conditions also, if that is not taken care of properly. Another surgical risk like hemorrhages, hematoma is common, any surgery. Effectiveness and long-term outcomes. You have to understand that myolysis cannot be an effective form of treatment, because there is a recurrence of the symptoms even after myolysis, because myolysis does not do anything to the cause of the fibroid itself. So effectiveness and also long-term outcomes, we do not know that even after myolysis is done, we do not know what the sources of heat or the cold or the ultrasound waves or laser or radio frequency can do to the uterine tissue, and we do not know how it will react. And if you're someone who is a teenager, who is not yet married, or if you're someone who's married and is planning for pregnancy, that might be a problem, because we do not know how it is going to affect the mother and the baby during pregnancy. So we do not know the long-term outcomes of it. And also the major thing or the risky factor is that even after myolysis, you can have a recurrence of fibroids again. So these are some of the risk factors of myolysis. Now coming into the homeopathic part of treatment for fibroids. Now let us see how to differentiate which one is better. We will do differentiating factor between myolysis and homeopathy. First thing, myolysis has effects and side effects, whereas homeopathy doesn't. Myolysis is invasive in nature, homeopathy isn't invasive in nature. You don't do any sort of surgeries in homeopathy. And also myolysis, we do not know the effectiveness of it. We do not know, even after doing all of surgical process, we do not know if the fibroid will shrink. But in homeopathy, fibroids will shrink within an effective manner, timely manner, and also without any side effects. We do not know that if we can get pregnant, or if we will ever get pregnant after myolysis, or if there is any sort of issue with the baby and the mother during pregnancy, because we do not know what these waves or the sound waves or these radio frequency waves will do to the baby or the uterus lining as such. But in homeopathy, because it's safe, it's effective, you can get pregnant after homeopathic form of treatment, and it will aid in fertility. Okay, and also in myolysis, we will see that there is a recurrency noted in myolysis, whereas in homeopathy, the recurrency factor is very low comparatively. And if you see in myolysis, you will see that there is no treatment or treatment based on the cause. There is no treatment for the cause. Here only we are removing the fibroids, which are the symptoms of the cause. Okay, here in homeopathy, we are taking care of the cause as well. We are taking care of the symptoms also. And also in myolysis, we do not know if it will regulate your symptoms. Okay, and also if you're someone who's suffering from PCOS with fibroids, bulky uterus with fibroids, endometriosis with fibroids, myolysis might not be a viable option, whereas in homeopathy you can treat triple symptoms, like it can be PCOS, it can be fibroids, it can be adenomyosis, it can be endometriosis. So we can treat variety of symptoms without any disturbances. So that is the effectiveness of homeopathy. We can also treat the cause, especially hormones. We can balance out the hormones which is not present in myolysis. So you can balance the hormones, you can regulate your menstrual cycle, you can prevent recurrences, you can relieve the current symptoms, you can cure your disease, and also you can prevent further more recurrences of this fibroids. As you can see, in the treatment of fibroids, compared to myolysis, homeopathy stands tall and is the winner in treatment of fibroids. Coming to the neglect part, what happens if you neglect these fibroids? Remember that fibroids are something that can grow, right? If they are growing, then sometimes it might not be an option to treat it anymore. It can grow so large that you have to get your uterus removed. First thing. Second thing, if the fibroid, not only one single fibroid will come, right? Fibroid can trigger other fibroids to form. So there can be multiple fibroids forming, and then hysterectomy might not be an option. Like, you can't do anything but get a hysterectomy done. And also there can be pregnancy issues if you're not treating this fibroid. The baby might not grow properly, or you might not conceive properly if the fibroids are not taken consideration of. And also fibroids can cause hormonal imbalance, as well as hormones can cause fibroids. So this is a cycle, and these can cause other diseases pairing with PCOS. It can cause endometriosis, it can cause bulky uterus, it can cause dysmenorrhea. So, if you are suffering from fibroids, make sure that you treat fibroids whenever they are small, whenever they are not paired up with, or even if they are paired up also, we can treat it with homeopathy. But do not, neglect fibroids, as it will go to a badder prognosis and we cannot do anything to it. It can cause severe hormonal disruption affecting the whole body. So make sure you get doctor consultation as soon as possible if you are suffering from fibroids. If you're someone who's suffering from fibroids, adenomyosis, endometriosis, PCOS or PCOD, or if you're someone who's suffering from bulky uterus, dysmenorrhea, Bartholensis, any of the female reproductive organ diseases, you can contact, or you can choose Fidicus Homeopathy, as we have high success rates. Here we have two kind of consultation options. The one is the online consultation option. The second one is the offline or the in-person consultation option. If you're someone who's staying nearby the nearest branch of Fidicus, you can come and contact us in person. But if you're someone who's staying far away from the nearest branch of Fidicus, you can contact us online through audio consultation options or through the video consultation options. And after the doctor consultation has been done, we will ask you for investigations, whatever are needed for your condition. And if you've already got those investigations done, you can share it with us. After this whole procedure is done, especially to the online clients, we will be delivering you our medications to your doorstep. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. If you're staying anywhere else across the globe, it can take 4 to 8 business days. We're mentioning here clearly it will take business days, because holidays and other things are not included in this. Particularly 3 to 4 business days is what we are proposing. If you're someone who are suffering from female reproductive organ diseases and you would like to get in touch with us, you can call us on this number. You can WhatsApp us or message us on this number. If you're someone who wants to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. If you're someone who's suffering from fibroids, if you're someone who's suffering from endometriosis, adenomyosis, or if you're someone who's suffering from bulky uterus, dysmenorrhea, PCOD, or any other female reproductive organ diseases, and you would like to choose homeopathy because we've told you how homeopathy works best for all of this, why should you choose Fidicus Homeopathy apart from other homeopathy doctors? Remember that Fidicus Homeopathy stands for highest chance of health. Here, compared to other doctors in homeopathy, we have highest success rate. We have top-notch doctors and we are treating it with high success rate. First thing. Second thing, we have transparent treatment. What do you mean by transparent treatment? We do not have any gray area between the patient and the doctor. Here we will be talking to you about your prognosis and also about the condition of your fibroids also, and also the personal care here at Fidicus is top notch. So if you want to choose health, if you want to choose cure, if you want to choose a doctor who is going to address all of your issues, answer all of your queries, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.